Hello, this is Ashley Kizar. I'm doing a presentation on the effects that pesticides have on agricultural workers. So pesticides, they are used to control pests in agriculture. There are three types: herbicides, which the main purpose is to kill weeds and to prevent weeds from infecting agriculture. The second is insecticides, which aim to prevent insects from destroying the crops, as well as fungicides, which is for fungi or fungal spores. So some of the health risks of the pesticides are cancer, and some of the cancers are lung cancer, pancreatic cancer, colon, rectal cancer, leukemia, non-Hodgkin lymphoma, bladder cancer, brain cancer, and melanoma. Also, there's congenital heart defects, neural tube defects, autism spectrum disorder, and these are all for children. And the next is Parkinson's disease, where there's a correlation between pesticide usage and Parkinson's disease. So who's at the highest risk? The highest risk is applicators, which is the people who actually spray the crops with pesticides, as well as the families of the applicators, and those who live near the farms. So as I said before, there is increase with agricultural workers specifically. There's increase of cancer risk and Parkinson's disease. So how it affects the families is with agricultural drift, which is when pesticide dust goes around. So pesticide dust, it gets transferred through the air to areas of the community that are not intended, like the crops. And there's, according to the article, relative contributions of agricultural drift, per-occupational and residential exposure pathways to house dust and pesticide concentrations. The further that a home is away from farms, there are shown to be decreased pesticide dust concentrations. So with contaminated water, a lot of the areas, since it is rural areas, they rely on well water. And so most well water they are found to be at least contaminated with at least one pesticide. And this is because the pesticides leach into the ground and get into the groundwater. As well as with the food, since the people are working on the farmers, they do have more access to the food that they're farming, which is sprayed with pesticides, and they're in turn more likely to have a pesticide residue in their bodies. There's also hygiene factors. So this is with like peri-occupational and residential, with like laundry, and when a farm worker, they come to their home and they have the residue on their clothing or their shoes, and they bring it into the home so it's not a carpet or onto the other people, to their family's clothing, and so there's a slight increase in residue in that way. By changing their clothes or shoes prior to entering the home, there is a decreased pesticide residue. So that's something they could do to eliminate it or to limit a little bit. Also with house cleaning, has shown to decrease the risk. And with pets that are outside and inside, so the pets go outside and they bring in some residue into the home. So residential use is when people just use their pesticides for their own personal use in their home. So some of the ways that it affects the families is through, for children from prior to 3 months before conception to 2 years of age. According to the article, the effects of neonicotinoid pesticide exposure on human health. There's increases of childhood cancer, autism spectrum disorder, congenital heart defects, and neural tube defects. And part of this is just the mother's health, the maternal health of the mother and her exposure to pesticides. So some of the regulations are brought on by the EPA, or the Environmental Protection Agency. So they have three areas, which is the risk assessment, risk management, and the worker safety program. So the risk assessment, they identify risks to environmental and humans. So they evaluate before any pesticide is able to be used. They have to be evaluated, and the EPA determines the safety of the pesticide that is going to be used. With risk management, they take the information from the risk assessment and determine if the pesticide can be used, and then how it's used, the storage, disposal, and application, and just safety protocols for that pesticide. So the workers' safety program has 3 areas surrounding under that category. So it's the agricultural worker protection standard. So they aim to lower the risk of pesticide poisoning and injury for agricultural workers and pesticide appliers. So some of the things that they want to do is provide safety training, try to limit the workers' exposure, and this is through protective clothing, face masks, gloves, boots, that type of thing. And they also want to decontaminate any supplies used for pesticides. And the pesticide applicator certification is so any person that applies pesticides, they have to be certified, and they have to be certified on the EPA, state, territorial, tribal laws in regard to the pesticide usage. So recognition and management of pesticide poisoning they have a manual that they give out to healthcare providers on how to treat the pesticide poisonings if there is one, and so to help the healthcare workers. So how can we help lessen the exposure or the health, or how to help the agriculture workers become healthier and not so exposed? Just more enforced regulations and making sure that all the laws and regulations that we do have are thoroughly applied and regulated. Also just training for all agricultural workers, as well as just flyers and postings everywhere for them to see and know their rights and all the regulations. To inform the public on health risks, we could do this through flyers, public meetings, news broadcasts, church programs or church organizations. Also, what we really need to work on is increase health coverage to agricultural workers and their families, as well as mandatory sick time. A lot of farm workers are low income, and so they just can't afford to take unpaid time off from work. And so so by having mandatory sick time, it is very important, and also just so that they're not going to be, they could feel like they're not going to be condemned or like hurt, like possibly lose their job or anything like that because they are taking sick time because of they need to go to the doctor. And also just increased knowledge of early detection of diseases and how important it is to get regular checkups, especially for things like cancer. And early detection is very important because they'll be able to prevent the disease from getting worse. And if they do have early detection, it's a lot easier for them to help fight the disease. And that'll be it for today. Thank you.